class. Today we will be discussing Chapter 3 in Reforming and Liberating Nursing Education in Susan Malka's Daring to Care. Prior to World War II, most nurses worked in private homes. After the war, the majority of nurses worked in hospitals. The switch of nurses from private homes to hospitals was referred to as the Great Transformation. A second transformation occurred when nursing education moved from hospital-based to colleges. There was more than one reason for the switch. The American Nursing Association pushed for the change. The idea of female submission and the stereotypical doctor-nurse relationship was starting to change with the second wave of feminism in the 1960s and 70s, and last, nursing educators realized that nursing education needed to be focused on more than just performing tasks in order for nursing to grow as a profession. The American Nursing Association published a paper recommending nursing education move from hospitals to college. This meant eliminating the hospital-taught diploma program and focusing on ADN and BSN programs, with the goal being BSN degree nursing as a standard. This proposal upset hospitals and nurses. Hospitals trained diploma nurses felt betrayed by the ANA. Hospitals feared they would lose control over training their own nurses. They were certain a change in education would cause a shortage of hospital staff nurses. Hospitals preferred training their own nurses to follow their model of care and productivity standards. The proposal caused a division between nurses, nursing organizations, hospitals, and other healthcare providers. New York State Nursing Association felt strongly in favor of the ANA's recommendations. They developed a plan to transition their education from hospitals to universities by 1972. New York's Hospital Association was not in agreement. They shared the same feeling as most hospitals of the time. They feared a shortage of staff and also a loss of control. They also preferred to train their own nurses with hands-on training geared to their facility. New York Nursing Association maintained their position on nursing education. However, they agreed to work with the hospitals to prevent a staffing crisis. The opposition continues, and hospitals and educators stand their ground. A turning point for nursing educators came after the Iowa debate. A college dean and VP of a hospital received public recognition. Dr. Hale, the VP of the Albany Medical Center, gave clues that the disagreement was about more than just education. Hale's arguments were sexist and showed male dominance. Hale's backwards ideas may have helped prove why nursing education should be moved from the hospital setting. Hospitals and nursing administration continue to disagree. Changes begin to occur. Public support for educated nurses increases. More nursing research is performed. Nurses developed theories related to their practice, and more programs were moved to universities. As ADN and BSN programs become more prevalent, hospitals continue to provide the clinical support for nursing education programs. Diploma program admissions begin to drop from 1965 to 1985. Hospital revenue shifts, and hospital funding for schools becomes a challenge. Which cause do you feel created the change? Second wave feminism, the ANA position paper, or economic influence? If you said all of the above, you are correct. Feminism, economic influence, and the ANA proposal all played a role in changing nursing education.